Welcome to Annapolis Mosaics. Our program spotlights people in our community who are involved in activities designed to promote good human relations. I am Michael Keller, the chair of the Annapolis Human Relations Commission and your host. The commission is a city board that seeks to promote equal opportunity and to eliminate discrimination. My guest today is Mike Drummond, the executive director of the Arundel Lodge. Mike, welcome to Annapolis Mosaics.
Thank you, Mike, and I appreciate you having us here today.
Certainly. Well, could you begin by telling us a little bit about the mission of the Arundel Lodge?
So Arundel Lodge partners with individuals and families and provides behavioral health services to promote their recovery.
Okay. What is a behavioral health disorder? What do you mean by that?
Well, it's a kind of dysregulation, out of function. Behavioral health disorders really have three components. One is thoughts, one is mood or feelings, and one is their behaviors. And so behavioral health disorders manifest problems in one, two, or all three of those areas of their lives.
Is this something that's common in society?
1 out of 5 people in the United States will be diagnosed with a behavioral health disorder at some time during their life. Mental health disorders include depression, schizophrenia, bipolar disorder, ADHD. There's a variety of mental health disorders, and of course substance use disorders are also part of this category as well.
Okay. The Arundel Lodge grew out of the government policy called deinstitutionalization. Could you share with our viewers what deinstitutionalization was all about? What did it do?
Well, prior, let's say in the early 1960s, almost everyone who had a mental health disorder was in a state psychiatric hospital. And as treatments improved, as medications improved, and as people realized that people didn't just need to be defined by this disorder, that they still had aptitudes, abilities, strengths in which they could live a meaningful life and have a life that's that is productive and meaningful to them. The process was to try to begin to provide treatment outside of the state hospital and allow people to return to the community and have richer, more meaningful, deeper lives. It's our vision, not that we want to see a world in which a mental health disorder or a substance use disorder does not have to mean that people are no longer productive or meaningful.
Mm-hmm. Well, it's your view, I believe, that the physical environment in which people live, in which they're cared for, is really important. How do you accomplish this goal, Mike?
Well, a lot of the people we've seen have experienced a lot of trauma in their lives, have experienced a lot of difficulty, may have lost hope. And what we try to do, even with our physical environment, is create a welcoming space that doesn't really ask, what's wrong with you, but asks the question, what happened and to you, and how can we help you with whatever's happened?
Right. Over the years, the Arundel Lodge has expanded its psychiatric rehabilitation program into a number of areas. And what I'd like to do is to talk about each of these areas and give you an opportunity to expound on them. The first is the outpatient mental health clinic.
Sure.
Can you tell us about that?
So we have an outpatient mental health clinic. It provides services at a number of different locations. Our main clinic location is at 2600 Solomons Island Road, Route 2, heading towards Edgewater. It was started in 2008. With about 225 patients. It now in the last year has served over 2,000 people. It's staffed with a psychiatrist, with two 32-hour psychiatrists and a psychiatrist who works for us for 8 hours, 3 nurse practitioners, and about 10 or 11 therapists. The thing, and this provides the diagnostic assessment for determining whether or not someone has a mental health disorder, is that amenable to treatment, and then provides the treatment, medication management, individual therapy, family, group therapy, to the people who come for our services. There are several things which I'm particularly proud of in terms of our outpatient clinic. One of them is that we have a Spanish-speaking psychiatrist and a Spanish-speaking therapist, so that we can treat people whose first or primary language is in Spanish and be able to offer a service that's accessible to them. Another aspect of our program, and this exists throughout all of our services, is that we treat people who are deaf or hard of hearing, and we have a therapist who signs and does ASL. We've begun using teletherapy. That is, the therapist is at our location, and people who are from the Eastern Shore or who are in rural areas and cannot access a therapist who knows ASL, begun to provide that therapy remotely to those individuals who live in areas where there is not a therapist who knows ASL. And we've started that program with a grant from the Stolman Foundation. Another key difference for our clinic than most mental health clinics in terms of being able to access services is that a person can present, if they decide, or if a family member decides, you know what, you need help, today's the day we're going to start getting you help. People can walk into our clinic between the hours of 9 to 3, Monday through Friday, and we can do that initial assessment and diagnostic evaluation that day, and if warranted, begin to initiate treatment. So oftentimes, it used to be that you would have to wait 3 weeks, 4 weeks, 5 weeks for an appointment. And that's another way in terms of what are you communicating to someone if they're in crisis that we'll be able to help you in 5 weeks. May not be timely.
And you've got a day program too, right?
That's right. So we treat obviously people with a range of impairments that are resulting from their mental health disorder. And for those who have the most impairments, we have a number of services which kind of helps them improve their functioning. One of those services is the day program, and we have a day program that serves over 100 people a day. It operates 4 days a week, Monday through Thursday. We serve a hot breakfast and a hot lunch, and we help people with learning life skills that allow them to adapt and manage things in their life, and despite the fact that there's a presence of a mental health disorder that may have significantly disrupted their functioning. Again, I'd like to talk a little bit about the things that we've tried to add to that program to make a better one.
Please do.
And one of the things which clearly differentiates us is the emphasis on the arts. We really believe that artistic expression is a way to build self-esteem, is a way to find a voice, and is a way to express yourselves. And we have a lot of very talented artists who come to our program. We have a gallery there to show their work. We do a number of shows throughout Annapolis. We've been at Quiet Waters, at the Maryland Federation for the Arts, at the Barnes & Noble down the street, a lot of different places. Nearly all of the artwork is for sale. If one of the pieces of artwork is sold, then 80% of the proceeds goes to the artist, and the lodge uses 20% of the proceeds to replenish the program. And we'd love people to come and visit and see the artwork there. Another difference is that we also really emphasize the use of peer support and peer support specialists. And
tell us about that.
And so one of the services that the peer support specialists provide is helping people develop what are called RAP plans, and they're trained in facilitating this process. And RAP stands for Wellness Recovery Action Planning. And so a typical RAP plan will include things like, what is it that I need to do every day in order to be healthy? How do I take care of myself every day? If I'm starting to feel distressed, what have I developed and put into my toolbox to allow me to manage that situation without it causing me further distress and it going downhill? people develop crisis plans so that if their illness becomes more acute, they have a plan in place in terms of who are they going to contact to help them manage this increasing crisis and who are they going to rely on at that moment. And then a post-crisis plan, so how do I get back to doing the things I like to do? How do I get back to becoming in charge of my life again? So peers are used to help other peers develop those plans. The peer support specialists also can act as advocates. If somebody has a rehabilitation planning meeting coming up or a treatment plan meeting, and they want to make sure that that our staff really understand what they're looking for to get out of this plan, then the peer support specialist can accompany that person to make sure that their input is clearly understood. And then, of course, we do a lot of other things. We take a trip usually once a month, some sort of exciting outing that they help plan. And we have lots of classes on living skills.
Okay. And you've got something called a home health program, too.
Right. This is a very exciting program, one that when the state began to make available the possibility to develop this service, I jumped at. The average life expectancy of someone who has a serious mental illness, something that's impaired their functioning in one way or another, is 25 years less than the general population. And that's related to a lot of different things. It's related to smoking, because there's a higher occurrence of smoking among persons with serious mental illness than the general population. It's related to a sedentary lifestyle. It's related to access to medical care and having one of our clients be able to be understood by the physician about the complaints they're having and what that may mean in terms of other medical illnesses. Folks with serious mental illness get all the same disorders that we get in terms of diabetes and cardiovascular disorders and the like. But somehow going, and we've all been to the doctor where you kind of go in, they take a few measurements, the doctor comes in, talks to you for about 5 minutes, and then writes out a prescription and tells you what he thinks or she thinks is going on. That model of delivery doesn't quite fit someone with a serious and persistent mental illness. So, the way we've built this health home is and again, very, very grateful for the collaboration we have with Arundel Medical Center, is we have a health home team. It consists of nurses, one full-time nurse and a part-time nurse, a super duper care coordinator, case manager who really knows how to access and medications and deal with insurance issues and things and the like. A physician who's a consultant who's also on the staff at the community health center that's operated by Arundel Medical Center, and together they assess each person. They develop an overall health plan for that person, and then they work with the person and the rest of our staff who are supporting them on how to implement that, what kinds of questions to ask, what things you want to have tested. In addition to having that team really promote the kinds of activities which are going to make sure that all disease processes get treated, we have several kind of IT things which help us do this job. One is that for people who give us permission, we're able to view the records at Arundel Medical Center. So if someone is getting treatment, say in their emergency room, our staff can also be looking exactly at their record, what's been done, what tests may be helpful in resolving whatever's happening for that person that brought them to the emergency room.
Well, we're going to take a break now, and when we return, we will be furthering a conversation with Mike Drummond about the Arundel Lodge. We're talking today with Mike Drummond, the Executive Director of the Arundel Lodge. Mike, one of the programs that you offer is something that's called evidence-based supported employment. What's that all about?
Well, evidence-based supported employment, the supported employment program is a program for those who express an interest in returning to work, helping them get a job. And evidence-based supported employment is a series of activities which have been identified by researchers as being the most effective way to support someone who wants to return to work. It too is a very important program because work is something which establishes meaning for people. It's something which says, hey, I am worthwhile. It's the way we all think about who we are and what our worth is. And so we went through about an 18-month consultation process with the University of Maryland to learn how to deliver that program and have fidelity to that model. And then we're reviewed once a year to make sure that we're maintaining that fidelity.
And you've also got something called supportive living too.
That's right. So so for people who need more supports because of the impacts of the mental illness on their lives, we can visit them at their homes, usually around up to 4 to 6 times a month is what usually we do, to kind of make sure that all the things that they need to manage are being addressed by that person, and to help them develop new ways of doing that if they're having problems with their medications, with their budgeting, with maintaining the household, and things like that.
You know, listening to the range of programs and services that you offer, I have to be impressed by the number of lives that you touch. Over the course of the history of the organization, how have you grown? What do your numbers look like in terms of the growth dimension that you've experienced?
Well, one of the first things I'd like to say is that it's an honor and a privilege to work in this field and to support the people whom we work with, and also to support their families whose lives will often be very impacted. And I've had very many family members, as well as people, really express a lot of gratitude for thinking about what things would have been like if we hadn't been there. And really, though, it's the folks who are in this struggle and making it work. It's an honor to be by their side when this happens. So we began with a residential program because that's what the problem was. The problem was people are living in hospitals, now they need to live in the community. And so that program currently serves 110 people who live in 32 homes throughout the Annapolis area and Millersville and Gambrels. And it's divided up into 5 subcomponents, which is a residential program for people with serious mental illness who are also deaf, for people with mental illness who are also have co-occurring substance use disorders, for people with co-occurring medical issues, and then an intensive support program, residential program, and then one for people who are becoming more independent. And we've grown because we began to realize, while that was very beneficial to those individuals and their families, there were so many more people in the community who were affected by mental illness. So we've really, over the last 8 years or so, done a lot of growing because we established that outpatient clinic, those off-site services, the supported employment program, the health home, that didn't only serve people in our residences, but served anyone in the community at large.
How do residents access your services?
Well, in terms of county residents,
yes.
All they need to do is to call 443-433-5900, and that will get them the number to schedule an intake appointment in the clinic. All of our services, people can self-refer themselves to, and we can do an evaluation to make sure that we're able to provide them based upon the medical necessity criteria. The only exception to that is the residential program. And that is basically an application needs to be made to the Anne Arundel County Mental Health Agency. they establish the waiting list for residential services, and when we have an opening, they tell us who's the next person whom we can consider for that.
Okay. What are the costs to users, and do you have any way of accommodating low-income individuals?
Well, first of all, we take medical assistance, which is an income-based insurance program, Medicare, and all private insurances for our clinic services. We also have a sliding scale for people who are uninsured and who need to pay for those services themselves. So we look at that. We try to help people get insurance because obviously it's not just their mental health we need to be concerned about. If you think about those statistics I said about life expectancy, it's their whole health. So if somebody comes in, they don't have a way to pay for the mental health services they need, we try to work to help them get access what they need to have insurance, and we can see people who are uninsured.
What would happen to people with behavioral health disorders if programs such as the Arundel Lodge didn't exist?
Well, unfortunately, we see a lot of what will happen already. It's unfortunate, but there's a lot of people who have a serious mental illness, and as a result of that, for the most part, create nonviolent crimes and end up in jail. Or we see people who have cycling back and forth to the emergency room, to an inpatient unit, discharged, no outpatient supports, return to the emergency room, hospitalized again. All of those things are unnecessary and ineffective ways of managing and helping someone with their mental health disorder, and that's really a shame to see someone caught in that crisis. And we're constantly trying to look for ways to try to be more welcoming, be more able to engage people who may not be sure or know whether or not they want to treat this disorder, or have this disorder treated for them. There's a huge barrier in this area which has to do with stigma. And to have a mental illness is a very stigmatizing, people who don't want to accept that they have a mental illness because of the way they view it, because of the way they see others view it. And unfortunately, as a community, it makes a whole lot more sense if we welcome people, we accept them for who they are, and then we help them address what their needs are.
Could you share with our viewers stories that you have experienced based on the patients and others at the Arundel Lodge that you think they would find especially interesting and that you find especially meaningful? Obviously, you're not going to mention names of people, but just life stories that you've seen and ways that you've helped individuals.
There was a young woman who came to us from a residential treatment center from out of state when she aged out of that treatment center. She had had a history of abuse. She was hearing voices and psychotic from a very early age. And she went to this RTC. She came to us afterwards, and she herself would describe her life as a mess before when she got there, and that she was a mess. And now she feels really good about who she is, and she's doing a lot of things that bring her pleasure and see how she's important to others. We have a woman who has been in our program whose daughter was killed in a home invasion, and it sent her into a very, very deep depression in which she never left the house. She herself lost her job and was just overwhelmed by the impact and the loss that she felt because of the loss of her daughter. But with treatment and with finding other people who could help her to not feel alone, and she was one who credits the art program as her way out of that darkness. She's now working again. She's very active. She's a member of our board of directors, and she's a bright contributor to the Annapolis scene.
Okay. What are the future plans for the Arundel Lodge?
Well, we are expanding. We have in our clinic and in our residential program and day programs the ability to treat people with mental illness who also have co-occurring substance use disorders. We've signed a merger agreement and will complete that merger to merge with another excellent organization in Annapolis called First Step Recovery Center. That's on Forest Drive. And together, we will improve both of our programs by being able to offer integrated mental health, substance use disorder services so that someone, no matter what the problem is, and of course you've heard a lot about probably the epidemic that the county, the state, the entire country is facing in terms of heroin overdoses. We'll be able to provide services to anyone with any of those disorders and actually help our services become more appropriate. Finally, we're also expanding into children. We've been an adult service provider, and we hope to very soon open up a children and adolescent clinic. We've reconfigured some of our space, and we're currently hiring staff now and hope to have that greatly expand the number of children and adolescents we're seeing. We see about 20 now, but we hope that this will give us a place where we can see many, many more in an environment that's welcoming to those children, adolescents, and their families.
Okay, Mike, I'm sure that our viewers would welcome more information about the Arundel Lodge. How can they get in contact with you in terms of a phone number, in terms of a website or email?
Okay, so our phone number is 443-433-5900.
Could you repeat that, please?
443-433-5900. Our email, or my email, is mdrummond@arundellodge, all one word, .org. And our website is www.arundellodge.org. We welcome volunteers. We have a big volunteer program. We welcome anyone who wants to contribute to this effort. So we really have greatly benefited from lots of different civic groups and individuals who become involved in supporting us, helping the people we want to help.
Okay. Thank you for viewing our program today, and please join us again on Annapolis Mosaics. If you would like more information about the Annapolis Human Relations Commission, please jot down the information that's on the screen. You can reach us at 410-263-7998 or by email at hrcommission@annapolis.gov, or check out our page at the City of Annapolis website. Go to www.annapolis.gov, click on City Government, then Boards and Commissions, and you can scroll down to the Human Relations Commission page. And always remember the words of Dr. Martin Luther King Jr., who said, "We have flown the air like birds and swum the seas like fishes, but have yet to learn the simple act of walking the earth as brothers and sisters."